A groundbreaking study out of Australia providing doctors with insight on what causes more infants to be susceptible to sudden infant death syndrome, or SIDS.
In the study, the infants that died had lower levels of the enzyme BCHE than the infants who lived. Fox 10's Irene Snyder spoke with a Valley doctor and a mother who lost her child. She joins us live with more. Irene.
Well, Christina and John, good evening. Children under the age of 1 are at the highest risk for SIDS. We did speak with a Valley mother who lost her daughter 12 years ago when she was 5 months old. It's a pain she says she lives with every day and certainly does not want any other parent to have to experience.
It never gets easy to talk about. It's been 12 years and it still never gets easy to talk about.
It was a sunny April day when Katie Cosma set her 5-month-old daughter, Taylor Page, down for a nap.
And when I went in to wake her up, she was gone.
Taylor was one of the about 3,000 babies who die from sudden infant death syndrome in the U.S. every year.
You know, we had gone to a parenting group and the nurse had said at a certain age it's okay to give them a lovey to sleep with. And when I found her, the lovey was over her face. And I will always wonder if I hadn't put her to bed with that, if she would still be here with us.
Researchers conducting a study out of an Australian children's hospital say they've identified the first biochemical marker to detect babies more at risk of SIDS. The study was done as part of a newborn screening program measuring levels of the enzyme BCHE from infants dying from SIDS compared to 10 surviving infants with the same birthday and gender. Those who died of SIDS had significantly lower levels of BCHE than the living infants. It also suggests SIDS may be associated with defects in the part of the brain controlling breathing and arousal from sleep. Dr. Gary Kirkless, a general pediatrician at Phoenix Children's Hospital, says the number of study participants is too small to draw any major conclusions.
I think it's an interesting study, but I think it's way too early to tell whether this is potentially the cause or cure of SIDS.
Katie says ever since she lost her Taylor, she's been on a mission to educate others, and she's hopeful that more studies and medical advances will help other families avoid this heartbreak and loss.
There's still so much work to be done.
And Katie continues to advocate in honor of her daughter, Taylor. She says that so far they've had walks, they have a website, and they've raised in the last decade $1.3 million to fund research for SIDS. Definitely some amazing work they're doing. We have more information about that on our website, fox10phoenix.com. Reporting live, I'm Irene Snyder for Fox 10 News.